Welcome back, viewers. So in today's session we will be discussing about the general anatomy of the cardiovascular system or the blood vascular system. So blood vascular system. So what are all the components which will make up this blood vascular system? So the components of this blood vascular system is, one is the blood which flows, and second one is the heart which will pump the blood, and the blood vessels which will carry this blood from the heart to the remaining parts of the body and which will carry blood to the heart as well. So these are the three components of this blood vascular system. One is blood, heart and the blood vessels. So the components of the blood, they are divided into two different types. So in the blood you have got plasma and you have got cells. So within the plasma you have got the cells which are related to the blood. Now what are the cells? The cells are nothing but the WBCs, RBCs and the platelets. So what are the names given to these? They are called as leukocytes, otherwise the WBC, erythrocytes, these are what we call them as RBCs, and thrombocytes. So these are what we are referring to as the platelets. So these are all the cells which are present within the plasma which will make up the blood. Now again there is a further subdivision in this leukocytes. So basing on whether granules are present within the cytoplasm or not, they are divisible into granulocytes. That means they have got granules in their cytoplasm, and the ones which do not have granules in their cytoplasm are called as agranulocytes. Okay. So now the granules which are present in the cytoplasm, they can take up acidic stain, they can take up basic stain, or they might not take up any stain. So basing on that, the ones which do not take up the stain are called as neutrophils. The ones which take up the basic stain are the basophils, and the ones which take up the acidic stain are the eosinophils. Okay. So in granulocytes you have got the neutrophils, basophils and eosinophils. Now what about these agranulocytes? These agranulocytes are monocytes and lymphocytes. They do not have any granules in their cytoplasm. Again, these lymphocytes, they are divisible into B lymphocytes and T lymphocytes. So what is the function of these cells? So ultimately the function of the blood vascular system. So what are the functions of the blood vascular system? So this blood, it will carry nutrients. So function of the blood vascular system is carrying and transport of nutrients, and it will carry oxygen to the tissues and CO2, and it will eliminate the waste products from the body. So this will carry the hormones to their target sites. So the hormones which are produced by the endocrine glands are released into the blood, and those are transported to the target sites by means of this blood. And other important function is the neutrophils, the lymphocytes, all these are important in protection of the body against infection, and also they play a role in immunity. So these are the basic functions of the blood vascular system. So these are all the functions of the blood vascular system. Okay. So transport of the nutrients and elimination of the waste products, and transport of the hormones to the target organs, and protection and immunity. So these are the functions of the blood vascular system. So now we have discussed the cells in the blood. What are the cells present in the blood? So we have discussed like there are B lymphocytes and T lymphocytes. Neutrophils, as I told you, they are concerned with protection against any infection. So defense mechanism. This monocytes, they help in engulfing the the foreign bodies. So they have a role in phagocytosis. And the lymphocytes, B lymphocytes are associated with humoral immunity, and T lymphocytes are associated with the cell mediated immunity. So that is about the cells in blood. So what about plasma? This plasma which is there, it is made up of 90% water, and remaining part of the plasma, it is made up of proteins, lipids and inorganic salts. So what are the proteins which are present in the plasma? The proteins present in the plasma are albumin, globulin and fibrinogen. So these are the three different proteins which are present in the plasma. So albumin, it helps to maintain the viscosity of the blood, and maintains the blood pressure, maintenance of blood pressure. Globulins, they have a role in immunity, and fibrinogen has a role in clotting. Okay, so these are the functions of the plasma proteins. So generally we refer to something which is called as serum. What is this serum? Plasma without the clotting factors is called as serum. So serum is nothing but plasma minus fibrinogen. So this is what will constitute the serum. Okay. So that is about the blood component in the blood vascular system. We have seen the different types of cells. We have seen what is present in plasma. So that is about blood. Next, moving on, we will discuss about the heart. So heart, as you all know, heart, it is made up of 4 chambers. So it is made up of a right atrium. So it is made up of 4 chambers. What are those 4 chambers? It is made up of a right atrium, right ventricle, left atrium and left ventricle. Okay. So these are the 4 chambers of the heart. The right atrium which is there, it will receive the deoxygenated blood from the body by means of superior vena cava and inferior vena cava. So superior vena cava will collect the deoxygenated blood from the upper half of the body above the level of umbilicus, that is from the upper limb, head and neck and upper part of the trunk, and it will take it to the right atrium. And this inferior vena cava which is there, it will collect all the deoxygenated blood from the lower half of the body and it will carry it to the right atrium. So the blood which enters into the right atrium, the deoxygenated blood which enters into the right atrium will pass into the right ventricle. So it will pass into the right ventricle through the right atrioventricular orifice. It will pass into the right ventricle through the right atrioventricular orifice, which is guarded by a valve which has got 3 cusps. So it is called as a tricuspid valve. Okay. So the blood which is received by the right ventricle, it is again entering into the pulmonary trunk. And from here it is being carried over to the lungs in order to get oxygenated. From the pulmonary trunk, the blood is carried to the lungs and it is getting oxygenated. So the oxygenated blood by means of pulmonary veins, it is entering into the left atrium. By means of pulmonary veins, it is entering into the left atrium. From the left atrium, it will reach the left ventricle through the left atrioventricular orifice, which is guarded by a wall which is called as bicuspid wall, and the blood from the left ventricle will enter into the systemic circulation through the aorta, and it is distributed throughout the body. So this is what actually happens in the heart. So these are the four chambers of the heart: right atrium, right ventricle, left atrium and left ventricle, and the orifices are the right and left atrioventricular orifice, and here you have got the pulmonary orifice. This is the aortic orifice, which are guarded by the semilunar valves. Okay, and coming to the structure of the heart, what are the layers of the heart from within outwards? From within outwards. So innermost layer of the heart is called as endocardium, and the muscle layer of the heart is called as myocardium, and the outermost covering of the heart is called as pericardium. So these are the three different layers of the heart: endocardium, myocardium and pericardium. So the heart in detail will be discussed when we learn about the anatomy of the heart in the thorax. So next, moving on, the other component of the blood vascular system. So we are done with heart as well. The other component of the blood vascular system is the blood vessels. So blood vessels. Blood vessels, there are different types of blood vessels. So one is artery and other one is vein. So we all know arteries, they carry blood away from the heart, and veins, they carry blood towards the heart. Generally, the arteries will carry oxygenated blood except the pulmonary trunk. The veins, they carry deoxygenated blood except the pulmonary veins. So that is the only exception. So again, in this artery, we have got two different types of arteries. We have got elastic arteries or large sized arteries, and we have got muscular arteries or medium sized arteries. So other name for these arteries basing on their function is elastic or large sized arteries are also called as conducting arteries. Conducting arteries, because they conduct the blood from the heart. Next, the muscular artery or the medium sized artery is otherwise called as distributing artery. Why it is called as distributing arteries? The blood which is conducted from the heart to this elastic arteries, it is distributed throughout the body by means of these arteries. So that is why they are called as distributing arteries. Now how did they get the name elastic and muscular? So that is basing on the content which is present in the tunica media. So we will discuss the structure of the artery. Okay, and basing on this, we can again classify the blood vessels like conducting vessels or otherwise the elastic and large arteries, distributing vessels or otherwise the medium sized arteries. Then you have got the resistance vessels, that is the arterioles, the smaller sized arteries. And then you have got the exchange vessels, that is the capillaries. And then you have got the capacitance or reservoir vessels, which are nothing but the venules and the veins. Okay, so this is one more classification. Okay, conducting vessels, those are the large arteries, and example for this is aorta, the brachiocephalic trunk, left common carotid and left subclavian arteries. Okay, and distributing vessels or medium sized arteries, examples for this is the brachial artery, axillary artery, ulnar artery, radial arteries. So I just gave an example of the upper limbs only. Okay, and then the next division, these arteries will further divide into smaller vessels which are called as arterioles, and then they further even divide into capillaries, and then the capillaries will open up into small venules. These venules will open up into the larger veins. So these are the classification of the blood vessels. Next, we will have a look at the structure. So any blood vessel, let it be a artery or a vein. I am not talking about the capillary. Let it be a artery or a vein. It is having 3 different layers from within outwards. So innermost layer is called as tunica intima. The middle layer is called as tunica media, and the outermost layer is called as tunica adventitia. So in this tunica intima, you have got 3 different layers again. Innermost layer of endothelium, and then you have got subendothelial connective tissue, and then you have got the internal elastic lamina. Coming to the tunica media. This tunica media, it is made up of smooth muscle cells and elastic fibers. So the outermost limiting layer for this tunica media is called as external elastic lamina. So this tunica adventitia which is there, the outermost layer, it is made up of connective tissue with fibers of collagen, elastic fibers and smooth muscle fibers, and then it has got the blood vessels which will supply these blood vessels, which are called as vasa vasorum, and the nerves which will supply these blood vessels, which are called as vasa nervosa. So this is the structure of the blood vessel. Let it be artery or a vein. It has got these layers from within outwards. Okay. So what is this endothelium made up of? Endothelium, it is made up of, so we will draw it over here. So endothelium, so if this is the lumen of the blood vessel, endothelium is nothing but flattened squamous cells, squamous epithelial cells. Okay. The special name given to the squamous epithelial cells in the blood vessels is endothelium. Endothelium. So outside this endothelium, you have got connective tissue. Okay, connective tissue, which we are calling as subendothelial connective tissue. And then the next layer is the internal elastic lamina. Internal elastic lamina, which is made up of elastic fibers. Internal elastic lamina. So these are the 3 different layers of the tunica intima: endothelium, subendothelial connective tissue and internal elastic lamina. Next, outside this you have got the tunica media. It is made up of smooth muscle cells or elastic fibers. So one half I will draw a elastic artery, one half I will show you how a muscular artery will look. So the name elastic and muscular artery, it is given its name basing on the predominance of these the content of the tunica media. So suppose elastic fibers are more in comparison to the smooth muscle cells, it is called as elastic artery. That is the large sized arteries. So they need elasticity. With each contraction of the heart, blood is being pumped into this large arteries. So they need elasticity. And in the distributing vessels, which are otherwise called as muscular artery, they have to contract in order to distribute the blood throughout the body. So they will have more amount of smooth muscle cells in comparison to the elastic fibers. So that is how they have got their name. So here above I am drawing the elastic artery and below is the muscular artery. So in the muscular artery, there are more number of smooth muscle cells and few elastic fibers. So what is happening because of that? The internal elastic lamina is not prominent in the elastic artery because it is mixing up with the fibers of the tunica media. But it is standing separate in the muscular artery. It is clearly visible in the muscular artery because the tunica media is made up of more number of smooth muscle cells. So that is the difference between elastic artery and a muscular artery in its structure. And next you have got the outermost external elastic lamina. External elastic lamina. And then coming to the tunica adventitia, it is made up of connective tissue fibers. Okay, connective tissue fibers. As I told you, they have got the blood vessels which will supply the blood vessel. Those are called as vasa vasorum, and the nerves which will supply the blood vessels are called as vasa nervosa. Okay. So actually, if this is the whole blood vessel, so how does it get its blood supply? Its blood supply, it is divisible into inner 1/3 part, inner 2/3 parts and outer 1/3 part. So outer adventitia and a part of tunica media, it is being supplied by the vasa vasorum. So 2/3 part of the media is being supplied by the vasa vasorum, the outer part, and the inner part, tunica intima with inner 1/3 of tunica media, is supplied by the diffusion of the blood which flows through these blood vessels. So that is how they will have their blood supply. So coming to the structure of the vein, so we have seen the structure of the artery here. Coming to the structure of the vein, in the vein, the tunica intima and tunica media is very much thinned out. If you see carefully in the artery, tunica intima and even more, the tunica media is well developed in a artery. But if you take a vein, tunica adventitia is well developed. Tunica adventitia is well developed. So it will have collagen fibers, elastic fibers and smooth muscle which is arranged in the form of bundles. So that is the structural difference between a artery and a vein. So if we have a look at the structure of the capillaries. So capillaries are nothing but the microcirculation which will connect this artery and the vein. So coming to the structure of the capillary it is made up of a single layer of flattened epithelial cells, that is the endothelium. So this is the simple structure of a capillary. The capillary won't have the tunica intima, media and adventitia. So it is made up of a single layer of flattened endothelial cells. So this is the structure of a capillary. And the size of the capillary is around 5 to 8 micrometers. Okay. So this is the microcirculation which connects the artery to a vein. Okay. Which connects the artery with a vein. So again these capillaries, there are two different types of capillaries. So what are the two different types? We have got continuous capillaries and we have got fenestrated capillaries. So fenestrated capillaries, they have gaps in between these endothelial cells which are covered by a layer of glycoprotein which is commonly referred to as the diaphragm. Okay. So these are the fenestrated capillaries which have got gaps in between the endothelial cells which is covered by a diaphragm. Now these type of capillaries which are continuous, though no gaps between the endothelial cells, these are called as continuous capillaries. Okay. So continuous capillaries, they are present in the skin, muscle. So commonly seen in the skin and muscle. These fenestrated capillaries, they are seen in the ciliary process of eye, choroid plexus of brain, in the intestinal villi, and in the endocrine glands, and of course the pancreas which comes under the endocrine glands. So few examples where you see fenestrated capillaries. So the two different types of capillaries are continuous capillaries and fenestrated capillaries. Okay. So that is about the capillaries. So what is the general order? So as you know, the blood will pump the blood, the circulation. Okay. So heart will pump the blood into conducting vessels first. So these are the large sized arteries. Then from here the blood will reach the distributing vessels. Those are the medium sized arteries. From here the blood will reach the arterioles. Now these arterioles will further divide into terminal arterioles and meta-arterioles. These will open up into capillaries. So at the tissue level, the blood is being supplied by these capillaries. Okay. So this is the place where exchange will also take place, because it is only single layer. Exchange will also take place at the capillary level. From the capillaries, the blood will reach the venules. From the venules, it will reach the large veins, and from the large veins, it will again reach the heart. So that is how the circulation will take place. So not always the arteries will end up in veins through the capillaries. So there are some situations where the arteries will join the neighborhood arteries and they will form a anastomosis. So the process by which the blood vessels or the arteries, arterial anastomosis I am talking about. So there are different types of anastomosis. One is arterial anastomosis and other one is arteriovenous anastomosis. So now, as of now, I am talking about arterial anastomosis. So the arteries, they branch and they join the neighborhood arteries to form a anastomosis. So the anastomosis is of two different types: actual anastomosis and potential anastomosis. So what will happen in this actual anastomosis? Again, this is subdivisible into two different types: end-to-end anastomosis, okay, and convergent anastomosis. So what happens in this actual anastomosis, and that too in the end-to-end anastomosis? So one blood vessel which is there, it will terminate and it will branch and it will anastomose with another blood vessel, thus forming a arcade like this. So such arcades we see in the palm. So superficial palmar arch, deep palmar arch. All these are the examples for this end-to-end anastomosis. So the terminal part of one artery will anastomose with the terminal part of another artery and it will form one arterial arcade. It will form an anastomotic channel. So if one artery is getting blocked, the other artery will take over. So that is called as end-to-end anastomosis. So example for that is the superficial palmar arch. What is this convergent anastomosis? So for example, we have got the vertebral artery on either side. Right vertebral artery and left vertebral artery will unite to form the basilar artery in the brain. So this is the vertebral artery and they will unite to form the basilar artery. So this process by which the two arteries of either side are uniting to form another artery which is of larger lumen in comparison to these fellow arteries is called as convergent anastomosis. Okay. So example for this is formation of the basilar artery. Next, what is this potential anastomosis? This potential anastomosis, this will take place at the terminal arteriole level. Terminal arteriole level. Okay. So what will actually happen is the artery, it will further subdivide into arterioles, small arterioles, and these will anastomose with the other arterioles. Okay. So this cannot immediately take over if this artery is blocked. This anastomosis cannot immediately take over and it cannot form the collateral circulation. So why actually anastomosis should take place is to provide a collateral circulation when one of the vessel is blocked. So in potential anastomosis, immediately if one of the vessel is blocked, they cannot establish a collateral circulation. Only if a certain amount of time is given, then these channels, they will open up and the blood will start flowing through them. And then they will establish the collateral circulation. Okay. So where do you see this potential type of anastomosis? We see it in the arteries of the heart, coronary arteries. And we also see it in the cortical branches of the cerebral arteries, that is the arteries of the brain. Okay, so this is the place where you see this potential anastomosis. So the important function of this anastomosis, arterial anastomosis, is to provide a collateral channel or collateral circulation when one of the vessel is getting blocked. So apart from this, as I told you, there is one more important thing, that is AV anastomosis. So what we have seen is arterial anastomosis. There is one more anastomosis which is called as AV anastomosis, where the arteries will form an anastomosis with the veins without intervening capillaries. So that is present in the lips, tip of the nose. Okay. So these are few sites where you can see the AV anastomosis. And apart from this, there is one more important thing which we have to study, that is end arteries. End arteries. So one thing is the arteries, they end up in capillaries and they will join the veins. One thing is the arteries will anastomose with the fellow arteries. Another thing is arteries will anastomose with the veins. But in few cases, the arteries, they won't anastomose with the neighborhood arteries or any veins, or neither they will enter into the capillaries. So those type of arteries which do not form any anastomosis with its neighborhood arteries are called as end arteries. So what is the importance of this end arteries? So if this end artery is getting blocked, that particular area which is being supplied by this end artery will suffer from ischemia. Okay. So where do you see these end arteries? Examples for this end arteries. One is splenic artery, then central artery of retina, okay, and then appendicular artery, and the arteries which will supply the bone. So these are few examples of these end arteries. So if these end arteries are getting blocked, that part which is being supplied by the end artery will suffer from a blood loss and it will suffer ischemia. So that is the importance of this end arteries. Okay. So with this, we will just move on to the different types of circulation. So there are three different types of circulation in the body. One is systemic circulation, other one is pulmonary circulation, and the third one is portal circulation. So what is systemic circulation? The blood from the heart which is being distributed throughout the body will make up the systemic circulation. All the oxygenated blood which is being distributed throughout the body, it will make the systemic circulation. The part of the circulation which enters the lungs for oxygenation and from the lungs to the heart after getting oxygenated, that part will form the pulmonary circulation. Now what is this portal circulation? Portal circulation is a circulation which will begin in capillaries and it will end in capillaries. Okay, portal circulation is something which will begin in capillaries and it will end in capillaries. So we have got the capillaries like this. And here we have got one more set of capillaries. Okay. Now these two sets of capillaries are being connected by one channel. So this one is what we are calling as the portal vessel. Okay. So it is beginning in capillaries and it is ending in capillaries. So where do you see this portal circulation? It is seen in three different places. It is seen in the liver, where it is called as hepatic portal circulation. It is seen in the kidney, where it is referred to as renal portal circulation, and it is seen in the hypothalamo-hypophyseal system, where it is called as hypothalamo-hypophyseal portal system. So these are the three different places where you see this portal circulation. Okay. So this is in total about the general anatomy of the blood vascular system. Okay. Even before ending, I would just like to make a note of few differences between the arteries and the veins. So arteries, as you know, it will carry blood from the heart, and those are thick walled and they'll have a small lumen and they are always accompanied by veins. Okay. And the veins, they are thin walled, the lumen is collapsed and they carry blood away towards the heart. They carry blood towards the heart. Arteries carry blood away from the heart. So those are the major differences between the arteries and the veins. And you have seen the structural differences. The artery has got well formed intima and media, whereas in the vein the tunica adventitia is more marked. Now coming to the applied anatomy in relation to this blood vascular system. So there are three different things. One is atherosclerosis, other one is arteriosclerosis, and other one is aneurysm. So what is actually happening here? In the atherosclerosis, there is deposition of the excessive lipid material, excessive cholesterol on the lipids. They get deposited in the lumen of the blood vessels. And sometimes they get detached and they will form plaques. Okay. And this can lead to blockage of the blood vessel. So that is seen with aging. After 45 years of age, this is the condition which we commonly see. So that is called as atherosclerosis. Now what is arteriosclerosis? Arteriosclerosis is thickening of intima and media, tunica intima and tunica media, by excessive production of collagen fibers, deposition of collagen fibers within the media. So what will happen? The elasticity of the artery will be lost. So the lumen will get narrowed. So the patient will suffer from claudication pain. So that is arteriosclerosis. Now what will happen in aneurysm? In aneurysm, the tunica media and tunica adventitia will get weakened. It will get thinned out. It gets weakened. So that when there is sudden inflow of blood, that can lead to a bulging, which is not reversible. So that is called as aneurysm. So these are all the applied aspects in relation to the blood vascular system. So with this we come to an end of the general anatomy of the blood vascular system. So hope you all have understood it well. Thank you for watching.